In today's Health Alert, cancer rates are on the rise among young adults across the country, but especially in Florida.
According to data from the state's Cancer Connect collaborative, rates of cancer were 3 times the national average, and more were being diagnosed at advanced stages. So let's turn now to our chief health editor, Dr. Partha Nandi. And Doctor, how much did rates increase, and were there any particular types that stood out?
Yeah, it's concerning, but I'm not surprised by this report, Brian. This is not just happening in Florida, because I'm seeing a bunch of younger cancer patients in my practice as well. Now, data from the Florida report found that cancer diagnosis rates shot up by 15% amongst people in their 20s and 30s over a 10-year period. Back in 2010, for example, the cancer diagnosis rate for this age group in Florida was 79.4 cases per 100,000. Since then, it's been steadily increasing at about 2% annually. By 2020, it increased 91.9 cases per 100,000. That's a big increase. Interestingly, the rate remains stable for men, but women under 50, well, they saw 11% increase during the same period. As for which types were most prevalent amongst young adults, breast cancer was first, followed by thyroid cancer, melanoma, testicular cancer, non-Hodgkin's lymphoma. Breast cancer not only had the highest increase in cases, but also was a leading cause of cancer-related deaths, with many being diagnosed at later stages. So it was important.
All right, so you speak of later stages. Are there any symptoms that are specific to later stage cancers that people need to be on the lookout for?
Absolutely. So times are changing. It used to be that young adults didn't have to worry about cancer, but now it's not uncommon, and that's why awareness is so critical in that these cancers are found and treated early when survival rates are higher. However, signs and symptoms will vary depending on the affected body part, but generally watch out for lumps, unexplained weight loss or gain, a sore that won't heal, a persistent cough, difficulty with swallowing, weakness and fatigue. It's also important to mention that certain racial groups have an increased rate, and this includes Black Americans, American Indians, Alaskan Natives, Hispanics, and mixed race people. Now, we don't know for sure why certain people, younger people, are developing cancer earlier. They are most likely factors at play, but modern diets, sedentary lifestyles, alcohol consumption, stress, smoking, and systemic barriers to healthcare may contribute. So to lower your risk, try to live a healthier lifestyle. We say a global diet is a huge risk, right, of early death. So we really look at what you're consuming on a regular basis, and don't be afraid to talk to your doctor and ask questions about body changes. And I believe advocating for yourself and your loved ones is essential in maintaining good health. And I'm seeing this all the time. So it's a combination of factors. What we can do is control the factors that we can.
And we know the experts keep on doing the research to try to find new ways to help limit this and treat it.
And we got to do our part. We got to listen to them.
All right. Thanks, Doc.
Appreciate you.
Of course. If you have a health question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter.